Let's move on now and take another look at the review and correct reports themselves. If you remember, in the beginning we said that the review and correct report is a user on-demand report. You request this and it comes up. It's confidential to you as a provider. It displays your information quarter over quarter. When each reporting quarter ends, that information is now available to you the next business day. You will be able to follow that information to obtain aggregate performance data for up to 4 full quarters as the data becomes available with each quarter. You can run this with updated information weekly until the data correction deadline. So this will give you the ability to actually look at this and see how it might be changing. On the report itself, for each quarter, you will see the data correction deadline, and you'll see an indicator as to whether or not that correction period is open, or if it has closed and you are no longer able to enter information. Updates or corrections to the underlying assessment data can be submitted into the KEYS ASAP system as long as it is before the data correction deadline that is listed on your review and correct report. This report, again, is accessed through the CASPER system. It's a snapshot of your current performance for a window in time based on the assessments that are in the CASPER system. It has quality measure information about your agency at the agency level. Remember from our knowledge check, it's an assessment-based information only, and it is not risk adjusted. It is only the observed or raw data that is being provided to you. Let's take a look at those data collection periods I've been talking about. There are 4 quarters in the year. Quarter 1, data would be collected and submitted from January 1st for the time period January 1st to March 31st. There's your review and correction period, April 1st to August 15th. Once you reach August 16th, that period is now closed. And you can see the successive quarters over the year, each with its own clearly defined collection and submission time period and a review and correction time period. We're going to look at the actual report itself very carefully. This is the header piece on the report when you've requested it and brought it up. At the top, it has the title, the setting, and the report number. It says CASPER Report, Home Health Agency Review and Correct Report, OASIS C2 Quality Measures, and it tells you what quarter you're looking at. Below the CMS logo, you'll find very important information about your agency. I cannot stress enough how important it is that you take this opportunity to verify that your agency's name, address, and telephone number are in fact 100% correct. Everybody makes mistakes. A typo is going to make a significant difference. So check this information, be sure that it is correct. If your Medicare number, your CCN, your agency's name, street address, the telephone number, if anything is incorrect, it's very important that you submit the correction and have your agency information updated. How would you go about doing that? You need to contact your Medicare Administrative Contractor, or MAC, to update that information. How do you know where to find your MAC? You see the live link is here on this slide. You're going to click on this, and the contact information for your MAC is going to be available on that link. Once you're on that website, click on your state, select it from the drop-down list. The contact information for your state will then be displayed directly below the map. you will find your regional office at this web link, and contact information for each regional office is available in the PDFs at the bottom of that page. So again, check that information, and if it needs correcting, use the last 2 slides to get in contact with the correct person. Now let's take a look at the rest of this report. First of all, we have a footer with a very important HIPAA disclaimer. This report may have privacy-protected data. It should not be released to the public. Any alteration is strictly prohibited. Remember, this is confidential data. Don't leave it lying around. The general items we're going to be looking at here are the name and the NQF National Quality Forum number for each measure. We're going to look at the actual table legend and each of the different sections, the reporting quarter, its start and end dates, the correction deadlines, and whether or not the correction period is currently open or closed. Excuse me, got a little bit of a spring tickle here. So again, above the table where we're going to go through each of these sections, there is another reminder legend. This is telling us that the episode data, a quality episode, begins with a start or a resumption of care, SOC or ROC, and ends with a death, discharge, or transfer. Additional measure-specific exclusions may apply, but that's part of the need for you to understand exactly how OASIS C2 data is collected and how it is processed. But remember very clearly how a quality episode is defined. SOC or ROC on the left, death, transfer, or discharge on the right. Those are the brackets. What happens in between is the quality episode. Now let's walk across the table itself. We're going to go through this fairly quickly so that you'll see different boxes as we move from left to right. The first is your reporting quarter itself. Second is your start date for that quarter, your end date for the quarter, the data collection deadline. When do you have to get all of your data corrections in? Is that data correction period still open, or has it already closed? How many episodes are included in the numerator, the top number for this measure? How many episodes are included in the denominator for this measure? And last, your agency's observed performance rate. How is this calculated, this observed performance rate? Numerator over denominator will give you that percentage. The numerator is the number of episodes that were eligible to be included. The denominator is the number of episodes that were included for this measure. Let's take a look at an example of a measure, improvement in pain interfering with activity. I do want to call your attention to the disclaimer at the bottom. Any data or rates that appear on all of the subsequent slides are displayed for demonstration purposes only. They do not represent any actual agency's results. So let's take a look now at an example of improvement in pain interfering with activity. We know what each of the boxes stand for as we went across from left to right. Let's just look at the numerator. 30 episodes were submitted that were in the numerator. 37 were in the denominator. And the observed performance rate was 81.1%. After that first quarter, as time goes on during the year, data from subsequent quarters will be added one on top of the other until all 4 quarters are there. When we move into the next one, when that newest quarter is added, the oldest one, our current quarter 1, will be dropped. and the next year's data, the first quarter from that year, will appear. So that what you have is rolling quarters. Only 4 quarters of data are displayed at any given time. Here's an example. You have quarters 1 through 4 for 2017. You can see all of the boxes are filled, the information is there. 2 of the quarters have data correction deadlines that have passed. 2 of them remain open. Now we've moved on, and you can see that the quarter at the bottom has dropped off. Quarter 1, 2017 is no longer visible because quarter 1 of 2018 has appeared at the top. That's what the term rolling quarters means, and that's how your data will be displayed as we move forward. It's time for a knowledge check again. Let's have a quick look at this question while they're loading our polling in the corner. When a given quarter's data becomes available, the Review and Correct report provides QM results that are updated on a blank basis until the submission deadline, weekly, monthly, quarterly, or annually. Oh, we have a little mix of opinion here. 75% believe that it's updated quarterly. 27% are saying weekly. If we're all done voting, let's have a look at the answer. And the correct answer is weekly. Let's move on to the next question. You as a provider can address your questions, correct inaccurate information, and ensure the accuracy of your information by which of the following actions? You can contact your MAC, contact your regional office, none of the above, or both A and B. Click in the circle. Numbers are shifting here. We have 72% think it's the MAC, 20% think it's both. Give that some thought, click in your answer, and now let's check and see which is correct. It is both A and B. If you remember when we did that slide earlier, you can correct your information by contacting either the MAC or the regional office. Let's move to question 6. The Review and Correct report contains patient-level data for each quality measure. Is that true or false? The report contains patient-level data for each quality measure.
Excuse me, we just wanted to remind participants they can take their mouse and click on the circle to the left of their response on the screen, and it will register their response.
Thank you. It appears that we have about 72% think that the patient-level data is in the Review and Correct report. Let's see what the answer is. That's not quite correct. Which of the following statements is an accurate description of that Review and Correct report? After the first quarter, data from the subsequent reporting quarters is added until 4 quarters are displayed. When 4 quarters of data are displayed, the oldest quarter is dropped to accommodate the newest reporting quarter. Do you think both of those are correct or neither of them? Click in the circle next to the answer that you believe is correct. After the first quarter, data from subsequent quarters is added until you have 4. When 4 are displayed, the oldest is dropped. Both are correct or neither is correct. 86% believe that both are correct, and they are right. We've just gone over that. After the first quarter, data from each quarter is added until you have 4, but there will never be more than 4 quarters displayed on a slide.